So today we've been running the Bridging the Gap conference, which is our big national event held here in Leeds for the first time, and it's about getting innovators into one room and listening to a full day of the entire offer that the HSN can give to them.
If you're a small business with a great idea, it's very hard for you to access the NHS, to know which doors to knock on, and so part of what we can do today is to try and find the right doors for our innovators to knock on so that we can help them start their market access journey into the NHS.
Orca is the world's largest health app library. We're all about helping people to be able to search and embed the best health apps into everyday life and practice.
So DockerBuild is a clinician deployment platform. It's a software that allows healthcare providers to see patients in their own home.
In this room today, there's literally hundreds of great innovators, and we're all on different tracks, but we're all heading in the same direction.
I'm actually doing a talk this afternoon, talking about my journey with the HSN and really just giving people an idea of what it's been like to start a digital company.
I'm really grateful to be here at this meeting, to actually have somebody from regulatory stand up and talk about what I do, because if people understand within SMEs that by looking at regulation early on in their development processes, they can get their products to market quicker, I think that's the message that I want to try and give to people.
It's not just Yorkshire and Humber who are here today. We've got representations from nearly all of the HSN's 15 networks, and actually the opportunity to all mix together and learn from each other is really important.
This wonderful piece of kit isn't only a name badge. If I flip it up, I can read what the agenda is for today.
These are very clever, these lanyards. The whole of the event, all the agenda is here. The layout of the building is on here, and it points you to where you can download the event from the event app as well.
When I meet someone who I would normally swap a business card with, I just tap theirs. It gives a little buzz and a light up. And I think everyone comes here with the attitude to network, so it's not uncomfortable trying to network, and people genuinely want to ask each other questions and don't seem guarded about their own thing.
Events like this are incredibly useful. At the end of the day, I don't think you can beat meeting people face to face and connecting with them. You get a real sense of what their priorities are and what's important to them.
This is a really vibrant ecosystem. The life science sector, the NHS voice through the AHSNs are really excited to be working together, and we know that we can actually transform patient care. We've seen in the last 5 years the AHSNs are changing patient services, changing care and delivering a much improved NHS, and that's something we all get behind.
The fact that people have dedicated entire day of their time to come here is pretty phenomenal actually. The buzz was huge in the morning, it was huge in the afternoon, huge amounts of questions, insight being given, lots and lots of great feedback from delegates, so I think it's been a really valuable day for everybody who's come.